It's another checkup for mom-to-be Whitney Saunders.
Miss Saunders?
Yes.
Hi, you can come on back.
Okay.
She's 7 months pregnant, just a few weeks away before she can deliver her baby boy.
I'm extremely excited. I cannot wait for this baby to get here.
This will be her first child, but not her first pregnancy.
This go round, it's like when you go through something bad, the second go round, you know what to look for, you know what questions to ask.
A few years ago, Whitney miscarried with twins. She was 5 months along.
I didn't feel like the necessary work was done in terms of making sure certain tests were ran. It really hit me. I would say I dealt with some postpartum, but for the most part, I mean, it just was one of those things like you just carried twins for X amount of weeks, and now it's like, okay, I did all that work, and yeah, I don't have anything to show for it.
This time around, Whitney says it was important for her to find a person of color as her OBGYN.
A lot of people just feel like they weren't listened to, which seems so basic, and it seems like we're really failing as providers because that's half of our job is listening. If you can't listen to be able to get the information from your patients, then you're failing them.
Dr. Ferrier and Whitney have talked through her questions, navigated her biggest concerns.
Preeclampsia, although it usually happens at the end of pregnancy, can start to happen early in some women, particularly women of color.
Dr. Ferrier says too often she hears from mothers, Black mothers, that they haven't always felt seen or heard by medical professionals.
We have to look at our own implicit biases of what makes us document a certain attribute about someone that looks a certain way, that they're aggressive, they're non-compliant, that they are easily agitated. That's going to color someone else's picture when they come back and pick up that chart to interact with that same patient.
From medical bias to gaps in postpartum care, she says women aren't always getting the care they need in the weeks after they deliver.
There's been a lot of legislation that's been pushing to cover insurance because a lot of women lose their insurance after 6 weeks. We have a bracelet for patients to wear that says, I delivered, I'm still at risk. I delivered less than a year ago.
There's also the issue of maternity care deserts. A March of Dimes report found that 1 in 3 counties in the U.S. are without a hospital, birthing center, or obstetric doctor. It's part of the reason why Dr. Ferrier opened her practice to make sure people in her community have somewhere to turn.
I've always wanted to be in a community where I can take care of people who look like me. And so I trained for medical school, my residency, and then I chose to practice in a more metropolitan area so that I can be of service.
Cara Burnett, WMAR 2 News.